Hi, everyone. I'm Dr. Michael Melia, the director of the Adult ID Fellowship Training Program here at Johns Hopkins. And on behalf of our fellows, our faculty, and our entire division, it is my pleasure and my privilege to have this opportunity to share with you some information about our program. Over the next hour or so, I'll start by sharing with you the mission of Johns Hopkins Medicine. I'll then go on to introduce you to the remainder of our program leadership. Then I'll spend a fair bit of time talking about the clinical training opportunities in which our fellows engage, as well as a good bit of time talking about the array of research training opportunities available to our fellows. To try to give you some sense for those opportunities, I'll share the research projects of our current fellows as well as recent program graduates, and then go on to share a few thoughts about living here in Baltimore. On the right-hand side of the slide, you can see our fellows getting together at a very serious moment on a morning recently where we welcomed the new fellows to our program. So the mission of Johns Hopkins Medicine, briefly, is to improve the health of the community and the world by setting the standard of excellence in medical education, research, and clinical care. Within our division, we go on to try to build on that mission by aiming and aspiring to train folks who will go on to become leaders within infectious diseases. And we have many, many faculty who are intimately involved in the professional development and training of our fellows. There are more than 90 faculty appointed within our division. And so I won't have capacity to share with you each of their expertises, but I will share just a few of the other members of our program leadership and our faculty, including Dr. Sonia Krishnan, the Associate Director of our fellowship program, a graduate of our fellowship program a couple of years ago, who has now a number of leadership roles within the Department of Medicine. In addition to helping to lead the fellowship program, she's also an associate director in the internal medicine residency training program here, and she still is actively engaged in tuberculosis-related research regarding the use of biomarkers for diagnosis, as well as transmission dynamics and so on. Dr. Sarah Cosgrove and Dr. Joel Blankson are the PI and the co-PI of the T32 training grant that helps to support our program. And they're also the chair and the co-chair of the Fellowship Research Guidance Committee, which I'll talk about a little bit later on in this presentation. Dr. Cosgrove, among her many areas of expertise, is a world leader in antimicrobial stewardship and drug resistance. And Dr. Blankson has long engaged in basic laboratory science, immunology-oriented research around HIV, elite control, as well as cure efforts, and more recently has spent a fair bit of time looking into the immunology of both SARS-CoV-2 infection and vaccination. So let's spend some time now talking about the clinical schedule, and you can see a number of points here that I'll talk about in some detail to try to give you a sense. We have a fairly front-loaded clinical schedule where the majority of the first year of fellowship training is spent engaged in clinical activities. We do this in part to try to set aside years 2 and 3 as much as possible for protected time for research, which I'll talk about a bit later. But the first year is a remarkable and a fantastic array of experiences within clinical infectious diseases. You can see that between 6 and 7 months will be spent engaged in general ID-related consultations. This is split between the main hospital at Johns Hopkins as well as the Johns Hopkins Bayview Medical Center. Johns Hopkins Hospital is a quaternary care center with all of the medicine specialties at our institution. So, of course, you'll have the opportunity to engage in consultations from internal medicine and also surgery, obstetrics and gynecology, psychiatry, neurology, and so on, all of the specialties of medicine, and really get a remarkable array of bread and butter infectious diseases cases, as well as very complex care of patients from a large geographic area. We serve patients, from Baltimore City, as well as the surrounding suburbs of Maryland, neighboring states, and then folks who travel from afar to seek attention at our hospital. So between the different diagnoses that we see and a variety of different patient populations within general infectious diseases and all of these domains, it is a rich array of experiences within clinical ID over the course of the year. At the Bayview Medical Center, it's a similar experience, a little bit more of a community hospital flavor at Bayview, a somewhat greater emphasis on bread and butter infectious diseases consultations, but also unique experiences that are not available or less available here at the main hospital. So at Bayview, for example, there's a burn unit which provides challenging and intriguing problems for the consultation service. And there's also the National Institute for Aging is based at Bayview. So more of a gerontology focus to try to complement the experiences at the main Johns Hopkins Hospital. The transplant oncology service is a service on which our fellows spend between 2 and 3 months over the course of the first year. We have a dedicated cohort of faculty who exclusively see patients on the transplant oncology ID service. And so this is based at the main Johns Hopkins Hospital and spans both solid organ transplantation as well as bone marrow transplantation patients who are actively receiving chemotherapy, and all of the associated infectious complications that can potentially befall such patients who are immunosuppressed for their diagnoses with a remarkable array of infections encountered over the course of the initial clinical year and actually the full complement of the 3 years of training, with really superb and dedicated training and education provided by our expert and wonderful transplant ID faculty. Fellows will spend between 2 to 6 weeks on our inpatient HIV service. This is it's a service on which the ID faculty serve as the primary attending of record. So the service runs for much of the year without an infectious diseases fellow present, but for a few months total over the course of the year, one of our first year fellows rotates on the inpatient HIV service and has an opportunity to help lead rounds and share thoughts about the initial and subsequent management of patients admitted to the service, and also to engage in a teaching role with the residents on service, sometimes about HIV-related problems, but also about potentially general infectious diseases-related concerns, overview of antibiotics, or thoughts on the management of other infections as well. It's a service on which predominantly patients with HIV are admitted, although patients may be transferred from other hospitals or otherwise admitted to the service if they have a primarily ID-related problem. So someone, for example, with overwhelming endocarditis or a comparable problem would potentially be admitted to that service. So a rich array of clinical experiences on the inpatient HIV ID service. Then, in addition to those intensive inpatient rotations, fellows spend a couple of weeks in the microbiology laboratory. We have an absolutely world-class microbiology laboratory staffed by Dr. Karen Carroll, who is herself an ID clinician, so really understands and appreciates the work that ID clinicians do in their care of patients. And so we typically will go down, the inpatient teams will go down to the microbiology lab at least once a week for teaching rounds about interesting organisms or other questions that have arisen over the course of the week for the evaluation and management of patients. And then in addition to that, fellows will spend a couple of weeks relatively early in the year down in the lab, meeting the key personnel, understanding the workflows and the processes that the lab undertakes. And it really ends up being a terrific experience in microbiology with our microbiology fellows who also typically spend some time with us on the consultation service, so that they also understand, the work that we do on the clinical side on the inpatient wards. In the second half of the year, our fellows spend a couple of weeks in subspecialty ID clinics. That might include immunodeficiency clinic, a diabetic foot infection clinic, tuberculosis clinic, sexually transmitted infection clinic, transplant oncology ID clinic, viral hepatitis clinic, and so on. It's a a number of really important infectious diseases related diagnoses, some of which fellows see quite frequently during their inpatient time, but may not necessarily see the outpatient aspect as much, and some of which is otherwise sort of not cleanly incorporated into the inpatient year. So it's a way to sort of round out the clinical experience that's important to an overall ID fellowship training program. And so we're happy to offer that a couple of weeks in the second half of the year. And then throughout the year, our fellows engage in their longitudinal general ID outpatient clinic. That is a mix of new patient consultations as well as follow-up patients who have previously been seen in the clinic and patients seen in follow-up after hospital discharge. The clinic is the two clinics in which our first-year fellows rotate are based either at Bayview, which is a couple of miles east of the main Johns Hopkins Hospital, or about 10 miles north at Green Springs Station, north of the main Hopkins Hospital, I should say. It's, again, sort of similar to the inpatient experience where the catchment for patients ranges from the city to the counties to neighboring states to people who sometimes travel from afar for an outpatient opinion in our clinic, and a rich array of different diagnoses, tick-transmitted infections, skin and soft tissue infections, recurrent cellulitis, chronic pneumonia, and so on. Between those sort of new diagnoses on the outpatient side, follow-up longitudinally of patients who we've seen in clinic, and then again, patients seen in follow-up from the hospital, it's a very nice and complementary experience to what you will experience on the inpatient wards over the course of the year. So it's really hard to capture in just one slide the really remarkable and rich clinical experiences in which our fellows engage. It's an intensive year and a fantastic year where by the end of it, you really have experienced a tremendous breadth of infectious diseases spanning all of these domains: general infectious disease, transplant oncology ID, HIV, and so on, as listed here. And we're very excited to talk with you more about the really remarkable experiences in which you can engage during your clinical year. During fellowship years 2 and 3, as I mentioned in passing earlier, we do try to set aside as much protected time for research and scholarly activities as possible. And so there are many fewer clinical responsibilities during years 2 and 3 than during year 1. So during year 2, all fellows have an outpatient HIV continuity clinic that is typically based at our Bartlett Clinic downtown at the main hospital, where fellows will have their own panel of patients and work closely with faculty who have years of experience managing patients in the outpatient clinic, with a complementary curriculum that I'll mention a little bit later on in the management of HIV contemporarily in 2024, 2025, and so on, led by Dr. Eileen Scully. It's a dedicated fellows longitudinal HIV management curriculum that is a nice complement to the outpatient HIV clinic experience. Fellows will typically provide roughly 8 weeks, between 6 and 8 weeks of weekend coverage on the inpatient services, typically split between the Bayview General ID service and then the Transplant Oncology ID service over the course of their second and third years, 6 to 8 weekends per year, each of those 2 years. And then in addition to that, between 6 and 8 weeks of jeopardy or backup coverage in the event that one of the fellows scheduled to work clinically is unable to do so. Those the jeopardy weeks also include covering the antibiotic approval pager over the weekend. So that is a concurrent responsibility, in part to try to free up a greater number of weeks and weekends for fellows over the course of the year. In addition to the responsibilities that I've already mentioned during years 2 and 3, there is an opportunity to engage in additional outpatient work during the second and third year of fellowship training, particularly if compatible with the fellow's sort of long-term career goals. So for example, if there's going to be a particular HIV focus, perhaps a third year of HIV continuity clinic, or if there's going to be a tuberculosis focus, then maybe trying to gain some additional experience in weekly tuberculosis management clinic, and so on and so on. So those opportunities certainly exist and are something that we look forward to talking with you about during your interview day with us. Just a few additional comments that I'd like to make about the clinical experience is that Dave Thomas, who's our former division director, when I first assumed responsibility for the fellowship program, mentioned to me that the main reason that we want to have fellows within our division is to help train them to become leaders in infectious diseases and help them succeed and thrive. It's not to bring in folks who will do all the clinical work of the division. So we try very hard to make sure that we have a balance of clinical responsibilities and educational efforts that really helps to maximize learning of clinical infectious diseases during the first year and throughout fellowship training. Part of the ways in which we do that is with the structure of our inpatient services. For example, each of the services has a cap on the number of new patients that each fellow can see per day. Happy to talk about those details. It varies by service, but I think important to say is that those caps were reached in a collaborative way with input from fellows and faculty to the mutual agreement of all. And so we have had that model for a while now, and it has worked really very well. So we make sure that fellows see an appropriate number of patients to make sure that they're learning what they need to learn, but also not too many patients so that they're overwhelmed and are not able to really engage in thoughtful clinical care where they're building on their education each day. Another aspect of that helps provide protected time for teaching and learning and education is that for each of our services, the general ID consult service at Hopkins, the general ID consult service at Bayview, and the transplant oncology ID service, we have parallel attending only services that help to offload clinical volumes and again, make sure that we have protected time for teaching and education. And actually, this year, 2024-25, for the first time, we now have a third attending service on the general ID consult service at the Johns Hopkins Hospital because volumes have been so significant over the past few years, and because we want to make sure that we, again, maintain our focus on the training and education of our fellows. And so that has been very effective. Again, the details are slightly different from service to service, but there's a lot of overlap. I would say a key theme as part of our focus on education is that the attending only services for a period of time each day will cover the pager, if you will, or respond to messages in Epic about new consultations and so on, so that the teaching services have protected time for rounding without interruption outside of messages that come through about patients already being seen on the teaching service. So we have protected time for teaching and learning every day that is facilitated by the existence of the attending only services. And then I just would highlight, as I mentioned earlier, that we have more than 90 faculty within our division, and among them are really nationally and internationally recognized experts in a tremendous array of topics within infectious diseases. And it is an extremely collaborative and friendly group of folks. This is something that one of the reasons I regret, although there are many benefits to virtually based recruitment, I think one of the things that's lost is that I worry that it's difficult to communicate effectively the extent to which there's really a collaborative and family feel between and among our fellows and faculty, and the ease with which fellows can reach out to these topical experts to ask questions when they arise is very easy to do, and the faculty welcome those conversations. And so it's a really nice aspect of training here, the ability to reach out to folks, either just walk down the hall and ask them, or send them a message to try to clarify a question about the care of a patient and expand their understanding of a particular topic. It's really a wonderful benefit of training here. Okay, so I was talking about our educational efforts, and certainly fundamental to those are our core conferences. We'll spend just a little bit of time here talking about a snapshot. There's certainly many more conferences than these that take place affiliated with our division over the course of a week, but highlighted here, I would say, are our core conferences that provide the greatest foundation of didactic learning that we provide for fellows in our program. So Monday morning, all of the transplant oncology ID, that's TOID, faculty get together and they talk about patients on the service to sort of solicit input from the different faculty on the service, share management questions and teaching points about the patients on the service. And it's a time that all of the faculty protect each week for again, for patient care and for teaching and learning. Excuse me. Then on Monday noon is one of our, I would say, three core conferences over the course of the week. That's our weekly Fellows Didactic Conference, which, as you can see, also includes Journal Club and Fellows Research presentations towards the end of the academic year. This is a time that we set aside just for the fellows. So the only folks who attend this conference each week are the fellows, Dr. Krishnan and I, and the faculty member who's talking with the fellows that week. And we do that. We close it off for a combination of reasons. One is to make sure that the fellows have a space where they can interact in a fairly intimate way with the faculty who are giving the talk. They can freely ask questions without hesitation, or others potentially asking questions or not providing them with an opportunity to ask questions. So it's a place where fellows can easily ask questions, and also they can come together. We all come together in person and sort of continue to build and grow the community that we have within our fellowship program. It's a great opportunity for the first-year fellows to be able to interact with and ask questions of our second and third-year fellows on a weekly basis. So at a minimum, we have all of the fellows come together every week for Monday noon conference. We have lunch and engage in some ID-related learning, and just are able to sit together with one another for an hour a week, which is wonderful. On Tuesday at 8:30, we have our weekly ID Grand Rounds case conference. I would view this as the second of our three really core conferences over the course of the week. You'll each have the opportunity to see this conference either live via Zoom during your interview day, or if your schedule won't permit that, then you'll be able to see this conference online either before or after your interview day. This is a conference where fellows, both the adult fellows as well as pediatric fellows, will present a patient with a known infectious diseases diagnosis, standard case presentation, and then once the presentation gets through the labs and imaging portion of the presentation, then the moderator of the conference, which is typically Dr. Paul Atwater, our clinical director, will ask a faculty member in attendance to discuss the case and share some thoughts and provide a differential diagnosis for possible explanations for the case. And then everybody will vote on what they think is the most likely diagnosis. And then the fellow will share the diagnosis as well as some teaching points about the case that they found interesting and wanted to read about a little bit further. So we have two cases every week, and the conference has existed essentially without change for the most part for about 40 years or so. It's a wonderful conference, and we're excited to have the opportunity to share it with you. Tuesdays at noon, 2 or 3 times a month, there's a clinical research conference that fellows are welcome to attend. There's a number of different folks that come from within or outside of the division to share their clinical research expertise, and it's a nice opportunity to get together and learn about some new work that's going on within the division. On Tuesday afternoons, quarterly, and then also I'll go to Thursday afternoon at the bottom. You have either the antimicrobial stewardship program quarterly meeting or the monthly hospital epidemiology infection control meeting that our fellows will go to a few times over the course of the year to try to get a sense at a minimum for what those meetings are like and the complexity of decision making from the perspective of both of those programs. Wednesdays, we don't have conferences largely because our first year fellows have their weekly continuity clinic on Wednesday mornings. On Thursday afternoon at noon is the third of our, I would say, 3 core ID conferences over the course of the week. This is our clinical case management conference, where the teams, it could be outpatient, but often inpatient teams will come with questions about the either evaluation or management of patients currently in the hospital. It's a hybrid conference where we have some folks in person, some folks present on Zoom, and it's typically a very lively discussion about, again, evaluation and management of patients who present challenges to the fellows and faculty who are involved in the care of the patients. On Fridays over the summer, we have our summer core curriculum. It's fundamentally very similar to the Monday noon conference that I mentioned earlier. Over the course of the summer, we just add a Friday morning aspect where we cover the bread and butter topics that first year fellows need to know as they're beginning their year. So, for example, we start with an overview of antibiotics, and there are talks about pneumonia and meningitis and osteomyelitis, endocarditis, urinary tract infections, and so on and so on. Tuberculosis is sort of core fundamental concepts to ID that are important for fellows to know about as they're beginning their year. That then transitions to medical grand rounds on Friday mornings once the summer ends. And then you can see on Friday afternoon, we sometimes have meetings. So once a month, Dr. Christian and I will get together with all of the fellows for a check-in meeting, to share announcements, solicit feedback, learn about challenges that have arisen that may require attention. Just make sure we have time to spend with each fellow, to spend with all of the fellows once a month, talking about the program and issues that warrant discussion. That is then followed, every Friday at 1 o'clock, there's microbiology rounds. I had mentioned that earlier, that this is now a dedicated time that's set aside, and all of the inpatient teams are expected to attend. The microbiology folks really look forward to this conference, as do the inpatient teams. There's advanced preparation where the services will let the micro folks know organisms that they wish to discuss or plates that they wish to review and so on. And the microbiology faculty and fellows do a fantastic job preparing and providing us with complementary education to that to which we discuss on rounds each day. And then I mentioned earlier, we have a longitudinal HIV curriculum for fellows. This really is intended for second and third year fellows. First year fellows, of course, are on rounds on Friday afternoons. But the second and third year fellows enjoy this conference over the course of the last 2 years of their fellowship training, where again, we review sort of all of the fundamentals of outpatient HIV care, so an introduction to antiretroviral therapy, contemporary complications associated with HIV infection, other management decisions and questions, and so on. It's a nice complement to another conference that I didn't mention, which is an HIV clinical management conference that takes place for the entire division on Fridays at noon, which fellows also often attend, where management decisions specific to HIV are discussed, as well as didactic talks about hot topics within HIV. So those two conferences are nicely complementary to one another, with the fellows curriculum, again, set aside for just fellows and the teaching faculty. So we're happy to talk with you more about these conferences. I know I've already said a lot about them, but it's really, I think, a nice array of offerings that we provide for the fellows. The idea, I didn't mention this, that the Monday noon conference, we roughly have an 18-month curriculum. So the curriculum repeats once, so that every fellow will see topics twice over the course of their training. And we have a nice series of talks, some of which are didactic and other professional development opportunity topics as well. And so it's a nice balance of different topics covered across all of these conferences over the course of training. All right. So with that, I'm going to now transition to talking a bit about the research years of fellowship training. And I'll just mention here a few highlights that I think are important to start with up front. I would open by saying that we work hard to make sure that we find mentors, a mentor or mentors that are the best fit for your needs and interests. And we do this with an approach that we have continued to hone over time to make sure that we're helping fellows learn about all of the incredible array of research opportunities and all of the faculty that are here within our division that are doing work that might interest them. So typically, actually, even right before orientation starts, we convene a brief meeting with each incoming fellow to try to get a sense for what their research interests might be. We understand that those might change over the course of training, but at least have some sort of preliminary sense about domains that might interest each fellow. And then based upon those interests, we put together a list. This is the folks that I mentioned earlier in the leadership slide. This is Drs. Cosgrove and Blankson and Krishnan and I. We'll put together a list of faculty who are engaged in work that's of topical interest for each fellow. And then during the new fellow orientation, which typically lasts around a couple of weeks, give or take, in the first 2 weeks of July, we'll set aside protected time during orientation for each incoming fellow to meet with faculty in their potential area of interest. So before even starting on the wards, each fellow starts to get a sense of the opportunities that are available here, the work that's going on. So at least those ideas might continue to sort of simmer in the background, if you will, as fellows start to get immersed in the clinical year and clinical consultative work. And then we have a number of meetings over the remainder of the first year to help ensure that, again, fellows are continuing to explore all of the available opportunities. So after fellows have their initial conversations with research faculty during orientation and then into the first several months of the academic year, then the four of us, again, Drs. Cosgrove, Blankson, Krishnan, and I, will meet with each first-year fellow again to sort of regroup in the October-ish timeframe, see if any new thoughts have come to mind, and start to talk a little bit about the initial meeting of the Research Guidance Committee, which I'll talk more about in a moment, that will take place in December of that year. And then there are subsequent meetings with the Research Guidance Committee over the course of fellowship training. So that is the process in a brief synopsis. By which we help to introduce fellows to research opportunities here and help ensure that they meet folks who share common interests and may be potential research mentors over the course of their training. This is then in addition to other sort of fundamental aspects that we provide include an introduction to just sort of the research experience generally during orientation. And then we have part of our Monday noon conference series includes the development of a research idea and crafting a manuscript and so on. So it's really a multifactorial process that we help fellows think about research opportunities, noting that we don't expect fellows to come into fellowship training committed to any one particular area of interest. Fellows who know what they want to do, that's fantastic, and we are excited to work with them and help them meet with their potential research mentors. And then an undifferentiated fellow, we also are excited to help them meet with folks with whom they can have productive conversations. So we're happy to talk more about this, and we look forward to it during your interview day about the process by which we help fellows partner with research mentors. I will say now a few words about our Research Guidance Committee, which is the point on the bottom of the slide here. This is a committee that's comprised of 15 or so faculty, and it's a it's a diverse group of folks. It is you have sort of age diversity and you have assistant professors and associate professors and full professors. You have topical diversity. There's antimicrobial stewardship folks and virology folks and immunology folks and clinical research folks, education, et cetera, translational science. And then you have domain differences. There's tuberculosis, HIV, again, antimicrobial stewardship, hospital epidemiology, bacterial pathogenesis of cancer, transplant oncology, ID. So it's a range of many domains within infectious diseases. And these folks come together, the whole committee comes together a couple of times a year, and each fellow gets to meet with the committee for 30 minutes. The whole purpose of the Research Guidance Committee is to provide fellows with helpful input as they sort of navigate their way through fellowship training. So fellows will share their thoughts and considerations about fellowship, about their research pathway, and the committee will provide guidance and points and suggestions and so on to try to help make sure that things are staying on track. Obviously, the topic of these conversations changes a bit over the course of the year. So during the first year, it's mostly on selecting a domain of investigation and a mentor. During year two, it's ensuring that things are on target and research productivity, and that the fellows are getting what they want and need out of their research experiences. And then year three, starting to think about transitioning to faculty or what the next step might be post fellowship training. And so it's a really great experience that we look forward to you talking with our fellows about, and we look forward to talking with you about. But it's folks who are very dedicated to the growth and development of our fellows over the course of their fellowship training. Nope. Apologies for the delay there. So I've mentioned a lot of this already, and I'll try not to belabor it. But again, there's many research mentors available here. Typically, our fellows will have a primary research mentor within the infectious diseases division, but there are many other potential mentors in other divisions within the Department of Medicine, other departments within the school, and also at the Bloomberg School of Public Health. And many fellows have had a joint mentorship or co-mentorship, perhaps a primary mentor within the ID division, but a co-mentor or co-mentors from other divisions and departments. And really what we want is for each fellow to put together a mentorship team that is going to help ensure their success as much as possible. And so we work diligently with each fellow to help make sure that kind of mentoring structure and team is in place. I will note that for fellows who are pursuing a research pathway, the division and the program guarantees 3 years of support during fellowship training. And there's a number of ways that we support our fellows during fellowship years 2 and 3. We have, as I mentioned earlier, a T32 training grant that helps support our program. And a number of our fellows are on our divisional T32. There are also other T32s, for example, a clinical pharmacology T32. We've had a number of fellows who have pursued joint training in infectious diseases and clinical pharmacology, so that's another option. There is no requirement for fellows to apply for or pursue their own funding for years 2 and 3 of fellowship training, but in the event that such an opportunity arises and that works out, in some, that's a sort of a win for everyone. And so that's something that we certainly support and try to help with where we can. And then if there's no other source of funding, then divisional support is provided to help ensure that fellows stay for 3 years of training and continue to pursue their scholarly work for their 2nd and 3rd years of fellowship. We also very enthusiastically support the training of folks who are primarily interested in a clinical pathway, and would just note that that is typically a 2-year training program rather than a 3-year program. And we're happy to talk more about that during your interview day. There are many places that fellows can go to pursue additional training. We really try to maintain a focus on years 2 and 3 of fellowship training being for skills building and skills acquisition. to learn things that you will then be able to carry on to the next phase of your career. So one of those pathways is the Johns Hopkins Clinical Research Scholars Program, and chiefly the Graduate Training Program in Clinical Investigation, or GTPCI, is an acronym that we may discuss during your interview day. So the GTPCI is a degree granting program available through the School of Public Health. Either an MHS or a PhD are available, and this is a fantastic pathway in which we almost always have at least one fellow per year pursue. And this is a degree granting program that provides fellows with the fundamental skills that they need in order to be able to engage in clinical research both during fellowship training and subsequently. If the full degree is not a good fit for whatever reason, all fellows have the opportunity to engage in coursework at the School of Public Health. All fellows get up to 16 free credits at the School of Public Health, and then any class can be audited at any point. So there's a number of training opportunities there, as well as additional courses that can be funded through different mechanisms tailored to each fellow's particular interests. And again, I know I've said this a few times, but happy to talk about those possibilities during your interview day. So that is sort of a snapshot of the research experience in general, just to try to put a few specifics around it. I'll share a little bit now about what our current fellows are doing. And so it's listed alphabetically here. Sean Anderson, one of our third-year fellows, is being mentored by Cindy Sears, and Sean is looking at C. diff biology, mucosal carriage and persistence, and also the relationship between C. diff and the pathogenesis of cancer. Also concurrently opening a new C. diff clinical center here at Hopkins, which is an exciting offshoot of the work that Sean and Cindy have been doing during Sean's second and now third year of fellowship training. Emily Hoff, one of our second-year fellows, is being mentored by Sean Falade Nulia, and Emily is interested in looking at the impact of social determinants of health on the PrEP cascade among women who use drugs. Emily is one of the fellows this year who's engaged in the GTPCI that I mentioned earlier, the Graduate Training and Program in Clinical Investigation, to help foster her skills acquisition in engaging in clinical research. Ruth Howe, another of our second-year fellows, is working with Yamu Lanachane, and Ruth is doing laboratory-based investigation, looking at bacteriophages and further pursuing her longstanding interest in novel drug delivery mechanisms in conjunction with Gyanu's longstanding work around non-tuberculous mycobacterial infections. Seth Judson, one of our third-year fellows, is working with David Dowdy. Seth has long maintained an interest in One Health and zoonotic infections, and so he is continuing his passionate interest for modeling yellow fever outbreaks and associated diagnostics, in Ghana, as part of, again, pursuing a long-term career in this space. Lucy Lee, another of our third-year fellows, being co-mentored by Drs. Robin Avery and Nate Permpelung. Lucy has long been interested in fungal infections, and so specifically during fellowship training, she's been looking at the epidemiology of and diagnostic testing for fungal infections in immunocompromised persons, particularly following a solid organ transplantation. Jillian Peters, one of our second-year fellows, being co-mentored by Drs. Yuka Manabe and Steve Reynolds. Jillian, again, long-standing interest in One Health and emerging and zoonotic pathogens, and so is pursuing work around novel diagnostics and other investigations in that space. Seema Sharara, the final of our second-year fellows here, is being mentored by Sarah Cosgrove, also engaging in the GTPCI this year, and Seema will be pursuing her interests in antimicrobial resistance, antimicrobial stewardship, and healthcare and hospital epidemiology. And finally, Kate Visek, one of our third-year fellows, is being mentored by Emily Kendall, looking at tuberculosis and specifically predictors of tuberculosis in patients who have a trace result on the Expert Ultra test. So it's hard, I know, in just one slide to sort of capture it, but hopefully this gives you a sense of, sort of the range of topics that are covered, the different kinds of research that our fellows are engaged in, the range of mentors that are available. And again, we're happy for you to look forward to you meeting our fellows during your interview day to talk about these interests, as well as faculty who are helping to mentor this and other work. So graduates from our program, you can see historically in the certainly recent to somewhat more distant past, have largely pursued careers within academics, but we certainly have had fellows graduating go on into work into other fields, including government work, whether CDC, FDA, or otherwise. Other positions might include clinically oriented positions, and then occasionally we've had folks go into industry, either directly out of fellowship training or subsequently, perhaps after initial work in the government, for example, with FDA, we've had some fellows then transition on to industry work. So there's a range of paths that fellows have followed following their fellowship training. In terms of other outcomes after fellowship training, I do want to note that our fellows have really been incredibly successful with K Award applications. As you can see, the success rate of fellows over the past now nearly 20 years is just over 90%. This is chiefly and unquestionably because of the remarkable fellows who have come through our program over this period of time. And I think it also reflects on the commitment that we have to the mentoring and the professional development and growth of our fellows over the course of their time here. Many of the fellows who have gotten K Awards have transitioned to faculty positions either here or elsewhere. There's no guarantee of transitioning to a faculty position with a K Award, but we are very supportive of folks' K Award applications and ensuring that fellows land in a great spot post-fellowship training. Outside of K Award applications, we've had fellows who are interested in government organizations. I mentioned FDA and CDC, as well as military medical research and clinical practice-oriented careers. The mentorship that we provide to all fellows is equally enthusiastic across all domains, and we're very, very proud of the great work that our fellows do and are so excited to talk with you about all of this further. In terms of recent fellow graduates, this is the past 2 years of fellow graduates. Again, I'll just sort of read over this to give you a sense of the work that the fellows have done and where they've landed. So Gerald Cherian was mentored by Sarah Cosgrove here, as a real interest in and expertise in clinical informatics, specifically around the identification of variables associated with harm from different antibiotics. And Gerald anticipates continuing to launch a career in this space and has now joined us as a clinical associate with a part of the staffing of the third inpatient service on the general ID consultation service that I mentioned a few minutes, 30 minutes or so ago, maybe, when I was talking about the structure of the inpatient consultation services. So Gerald doing some clinical work this year while also moving forward with his clinical informatics and associated research interests. Luis Gonzalez Coro just graduated from our program in June, was mentored by Greg Lucas and Kathleen Page. Luis had many interests around community-based participatory research, investigating social determinants of health as barriers to initiation of treatment for hepatitis C and HIV infection, and pursued this area of investigation with great success, and transitioned to a faculty position at NYU, where he is an assistant professor, continuing to engage in this work about which he has long been passionate. Derek Hareza also just graduated from our program in June, was primarily mentored by Pranita Tama in antimicrobial stewardship, and Derek pursued his passion for the clinical and molecular epidemiology of ESBL-producing Enterobacterales infection, and similarly transitioned the great work that he did during fellowship training to an assistant professor position in Northwestern, at home in Chicago, where he is from and has family, and so so we were thrilled for Derek transitioning to faculty post-fellowship training. Chelsea Modlin graduated a couple of years ago, was co-mentored by Larry Chang and Joe Ali during her fellowship training, has long had an interest in the ethics around scientific investigation on a global health perspective, and specifically looked at structural barriers to equity and research collaborations during her research training. Dr. Modlin is one of the fellows who pursued a K Award application that she successfully obtained. So she has joined our faculty as an assistant professor, where she continues to engage in clinical work alongside her fantastic research within the ethics space. Danica Rockney graduated alongside Chelsea and Gerald a couple of years ago, worked with me on her longstanding medical education interests, and specifically around ID-centric curriculum development, specifically around the development of a curriculum looking at cutaneous manifestations of infectious diseases. She parlayed her fantastic work during fellowship training to a clinical assistant professor position at the University of Michigan post-fellowship training. Juan Sung finished his fellowship training again in June alongside Luis and Derek, was mentored by David Dowdy, and pursued his research interests in machine learning around the characteristics of persons with, again, a trace result on the Expert Ultra test, and specifically around using artificial intelligence algorithms and reading chest radiographs to try to identify findings that are suggestive of a diagnosis of tuberculosis. Juan has submitted a K Award application with favorable scoring, and while waiting for the details of that to be sorted, he's stayed on as a research fellow to continue his fantastic research work in this space. Dr. Morgan Walker was our fourth fellow who graduated this past June. Dr. Walker did a combination of critical care training at NIH, and also Morgan did her ID training here with us. She was primarily mentored by Samir Kadri from NIH. And as you can see, she was also interested in antimicrobial resistance and stewardship. And so Morgan looked at the appropriateness of use of different antibiotics after the publication of guidelines around the management of multi-drug resistant gram-negative bacillus infections, as well as appropriate therapy for carbapenem-resistant Acinetobacter baumannii infections. And Morgan is staying on at NIH to continue the incredible research in which she engaged during her fellowship training. And finally, Diana Zhang graduated a couple of years ago, was primarily mentored by Dr. Anna Durbin during her fellowship training. Diana had multiple interests, including medical education and vaccinology. Some of her research work during fellowship training included in vitro investigation of antibody-dependent enhancement of Zika virus infection. And she also worked to combine actually her interests in vaccines and medical education through some novel projects over the course of her training. Diana took a faculty position as a clinical assistant professor at the University of Pittsburgh, where she, like everyone else on this slide, is thriving. So we're happy to share these experiences of our program graduates with you, and perhaps you'll have the opportunity to meet some of them on your interview day, and look forward to talking with you more about their experiences when you visit with us. So, as we near the end of our time here, I'll say that our program, in summary, includes spectacular clinical training. Hopefully you've gotten some sense for that over the course of our time here. Really limitless research opportunities with world-renowned faculty, both clinically and from a research perspective. We are very deliberate about the individualized fellow-centered mentorship that we provide to all of the fellows in our program, which exists within this incredibly collaborative, collegial, and mutually supportive environment that, again, hopefully you'll get a sense for over the course of the time that you spend with us watching these videos and visiting with us during your interview day. A few details just to share in terms of financial aspects of the program. You can see pictured on the slide here are the fellows for salaries during each of the 3 years of fellowship training. We are these have increased in part through advocacy through our graduate medical education office and many others over the course of the past few years. And so we're pleased that there have been such improvements in these in the relatively recent past. And then in addition to those, there's a number of other financial aspects to our program. All first-year fellows are provided with up to $1,000 for reimbursement of work-related expenses, which could potentially be, for example, cell phone bills or books or related activities that are relevant to the first year of training. High volume clinical activity. Folks spend a bunch of time on their phones, obviously, for clinical work, and so that's something that can be done during the first year of training. Years 2 and 3, fellows have research funds for either research again or work-related travel. All T32 fellows are given funds for this purpose, and so to help ensure we are make a very concerted effort to make sure that fellows have equitable experiences across the board. So T32 fellows get a certain amount of funds for research and work-related expenses, work-related travel expenses, and then we ensure that non-T32 fellows get the same amount of funds for the same purpose. Health insurance is provided for fellows and families. We have an internal loan repayment program separate from the NIH loan repayment program that provides up to $5,000 of loan repayment per year per fellow. So this has the potential to be up to $15,000 for a fellow over the course of their 3 years of training. And then we have long provided reimbursement for fellows to participate in a board's review course during their 3rd year of fellowship training. So there are a number of ways that the division and the tries to assist with financial aspects over the course of training. And then Baltimore is a wonderful place. We look forward to the fellows talking with you about their experiences living in Baltimore during your interview day. They're probably our best ambassadors for the program, but I'll say that my wife, Joanna, is also a faculty member here. She's in the gastroenterology division and primarily does translational science. And, when she finished her fellowship training and we were thinking about, the institution at which we wanted to try to co-localize, it was very easy for us to try to want to stay here at Hopkins. It's just it's a fantastic place to work and live, whether in the city or surrounding communities and counties, and where it's a wonderful place to raise a family and have a rich array of diverse cultural and other experiences. So we're excited to talk with you about all of those possibilities when you visit with us. Here we have our fellows who just graduated. This was at a restaurant. That's the explanation for the background that you can see. But Morgan, Luis, Derek, and Joanne on graduation day. And here's everyone who attended the fellowship graduation. Just one of the many joyous days that we all celebrate together during fellowship training. So this has been a lot of information. I know there's a lot more information, if you can believe it, on our website. So there are a number of other videos there that span a range of different topics. There's several that are posted just by our fellows, talking about the clinical experiences here, the research experiences, what it's like to live in Baltimore. And then there's a number of other videos from faculty about research and mentoring, diversity and equity and inclusion, and a number of different domains on the website. So there's no obligation or expectation that you would watch any of those, but if you'd like to explore further information in that space, we welcome you to do so. And again, look forward to talking with you more about it when you visit with us. And then the GME office website for our institution provides a virtual tour of the Hopkins Hospital and the Bayview Medical Center. I know we appreciate that's one of the limiting factors about virtual recruitment. So to try to take a tour of the hospital, please visit this website and you'll have the opportunity to do so there. So that's the end of our time together. Thank you so much for watching this video. Again, we're thrilled that you've applied to our program. We really look forward to talking with you further about our program and opportunities that are available here during your interview day. And so thanks for taking the time to apply and visit with us. Have a great day.